So oftentimes I'm asked, what is it that you do, Keoma? What is it that you really do? And sometimes it kind of making me stop for just a few seconds to think like, hey, what is it that you really do, Keoma? Because I I do several things. I do several things. Yeah, I do several things. But one of the things that I do, or one of the things that I am usually called to do, is help people. And sometimes it feels like a job, honestly. Like it takes so much out of me, but, and so much out of me, and not knowing for how long it will be for. But persons usually call me and said, hey, or I have, or I know someone who has cancer, or they have this, or they have that, and we would like to know if you're able to help. And these things have happened so many times, but this is a part of my life that I do not publicize. I do not talk about it. You will hear, oh, I'm busy, I'm doing this, I'm doing that, but it's like pieces of everything that I do in my life that I focus on. But there are things that I do, which is help people. You might be thinking, okay, help people how? So, for several times or many times, persons, as I said, will contact me and say, hey, I need your help, I need this, I need that. And then basically, what I do is I get in contact with the person and I ask, okay, what is the problem? I listen to the problem, and based on what I'm told, I act based on that. I use what I'm good at. I use my network. I use whatever, and I assist to fix whatever needs to be fixed. But one thing is I need to say to make clear is I do not associate when I help someone, or if you call me, you or someone call me to assist you or to assist someone. I do not use that situation as a personal situation. I do not use that situation as, oh, I have a problem with you, so I can't help you, or I know you and your friend had a problem with her, so I can't help her, or your friend had a problem with my sister or my brother and I can't help you. No, I don't do that. If person could have been homeless or can be homeless or wherever, if you call me and you say, hey, I need your help, I will help you. I will help you. The circumstances around doesn't matter to me. Your best interest or the person's best interest is what I care about. That is what I act on. That is what I make decisions on. If the person is an adult, I will let the people closest to them that are involved or that I'm in contact with or has contacted me, I will let them know, step by step what is happening. They will be my liaison person. I keep in contact with them. If the person needs to do this daily, I will say, listen, ensure that this person does this daily, please, because I am not always physically there, but I utilize WhatsApp. I don't call people. It's too expensive to call. So I utilize WhatsApp. I utilize whatever form of digital, whatever form of medium I can get to use to keep in contact, whether it be Skype calls, video calls, whatever. That's what I do to utilize. And I use my personal network to either lobby to get the person to the treatments that they need, to get back to their country, to get out of their country for treatment. I put myself in situations that you all would never imagine. And more so, people won't ask, how are things going? How are you getting through? Let me make this clear. When I contact a treatment center for on behalf of someone that I'm helping, that bill comes to me. All right? That bill comes to me. So I have to then find ways to make sure that that bill is paid. All right? I have to find ways to make sure that that bill is paid. I have to find ways to make sure that that person continues to be okay. And that person who is working with them hands on have our mutual communication remains clear, remains consistent. You know what I mean? So, in that process of me helping people, family aren't considered, whatever aren't considered, personal emotions aren't considered. What is considered is what is best for that person. What is best for that person. So if that person's living condition does not support their health situation, that person have to be removed from that living situation, that living condition. They have to be removed because it makes no sense that you're there trying to help somebody and the environment that they're in does not support the help that you're giving them. Everything has to gel. You know what I mean? Everything has to go hand in hand. So if one aspect doesn't support it, the other aspects will not. So we need things to be synchronized, and that is what I do. I assist to make the person's situation better, and for whatever care they need, I use my personal network to do it. Someone asked me once if I get paid for this. I said, no, I don't get paid for it. No one pays. People argue, people curse, people have what not to say when you make certain decisions. You know, some people believe that decisions are made today it should be planned. These situations aren't planned. You may speak to somebody today and tomorrow you gotta call and say, hey, we're ready now. They're ready now, you gotta go. You gotta find that money. The money have to come from somewhere because that person needs to go. Because that's exactly what it is. So when I'm involved in something, I go the full distance, the length. But the public doesn't know about that. I don't broadcast it unless it gets to a certain point that I think it needs to be broadcast. But the public doesn't know. But I get myself in certain situations helping people. You understand? And it's something that I do because it's my personality. If I'm doing something, I go the full way. I don't do anything halfway. If I do something halfway, I'm not into it. I will stop. But once I'm in, I'm in. And yeah. So don't feel to yourselves or don't think or I think I should just tell you. Nothing is personal. Not a thing is personal. There's too many things. There's too many things that are far more important to take things personal. There is nothing that is personal. Everything is always done in the best interest of that person that needs the help. Everything is always done in the best interest. Is whatever that person needs and requires to be better is what needs to be done. And that is what I do. The person needs treatment. The person needs to leave the country. The person needs to go to the country. You know what I mean? The person needs a medical card. The person needs this. The person needs that. The person needs a treatment that costs 28,000 US dollars. That's what they need. Do we say, oh my God, I don't have 28,000 US dollars? The person needs it. So we will let that person go, or I will let that person go, and we will find a way to pay for it. So we can discuss the payment. You know what I mean? We can discuss those things, but the well-being of that person and the support system that that person needs, those are the things that matters the most to me when I'm helping someone. Your emotions is the least of my concern. What your thoughts are, of course you can share them, you know. We can work together to make it all better. But I don't associate personal emotions and personal relations and personal this and personal that to any situation. If you're a stranger on the street and you ask me for help, I will help you once I'm able to. And helping someone you don't have to get money to help someone. The fact that you're capable of The fact that that person asks you is because you're capable of. So that's what I do. So just understand that, right? Just understand that. It's nothing personal. It's not about, oh my God, I scorn you, or oh my God, I can't touch that. No. It's about diving in. That person needs you. You put your feelings aside, you put your emotions aside, and you help that person. If it means to help them for 9 months, to 3 weeks, for a year or 2 years, that's what it is. You help them. That's what I do. No recognition, no nothing. I don't need it. What gratifies me is the rewarding seeing that that person is better. When that person say, I feel hopeful. When that person say, I feel good. I'm hopeful. I'm feeling better now. And I can see, when I can see that that person is really improving, that's what matters to me. That is what matters to me. Nothing else matters.